Hello, everybody. This week I wanted to talk about postpartum recovery, kind of cover the first week throughout the first year for you guys for our tidbit this week. So postpartum recovery will look a little different for everybody. Contributing factors such as number of pregnancies that you've had or how you delivered will definitely influence how you experience your recovery. These milestones are just general stages of recovery and are here to kind of help you recognize and normalize the mental and physical changes as you heal in your beautiful postpartum body. I think that this is a great thing to review during your pregnancy and maybe just a review when you know that you're going to have baby or shortly after, just to remind ourselves of what this could look like. I think that we tend to concentrate a lot on delivery, which I think is great, but I think it's also important to kind of pave the way of what it may look like afterwards for us as well. So week one, the physical status post-vaginal delivery. So of course, we're going to be hurting quite a lot. So this is depending on if we have to be, like if we are bruising, if we teared, if we had to have the episiotomy of like cutting to make more room for baby. So just depending on that, of course, is going to come a lot of hurt and pain. But bleeding is definitely normal, and our uterus starts to contract back to pre-pregnancy size. So that's one thing that we definitely feel. We feel that a lot actually when we are breastfeeding. It's quite an interesting feeling how breastfeeding actually helps contract the uterus to go back to that pre-pregnancy size. And it will no matter what, no matter how you're feeding baby. But I think that it just our body's natural way of just helping it along. Physical status post C-section delivery. So movement, obviously, it's going to be very difficult. Your incision can be painful. Moving around is encouraged, of course. It can help, prevent any sort of like blood clots, and it's just good for us to move our bodies. However, you want to take it very seriously in your movement as well, because we cannot be doing any sort of heavy lifting, and definitely we cannot be overdoing ourselves. So just make sure that you don't do that and that you're taking care of you as well. And if you can, to arrange some help around the care of baby, because you have to also care for yourself. So mental health and hormone status, prolactin and oxytocin levels are dramatically increasing and is important for our milk supply. That's what it's there for sure. Oxytocin also helps with that's like our love hormone. So it just helps a little bit extra with that attachment and bonding. You will feel exhaustion and feelings of being overwhelmed. Of course, that's going to happen for sure, right? But hormones definitely have a lot to do with that as well. Or lack of sleep, let's face it, crying or feelings like nothing's going right, and that can occur. Day 3 in particular, we find is the most difficult, that birth buzz. So believe it or not, that adrenaline kind of that it just like feels good, that birth buzz that you have for a little while, well, it does tend to kind of start to wear off and peter down for day 3. And estrogen and progesterone levels are starting to drop off, while the prolactin and oxytocin levels are starting to rise. So, I mean, a lot is going on with your body right there, just with hormones alone, that we're going to feel some emotions from that. We'll feel off and on of that for the first 6 weeks. But once we are hitting week 6, you'll definitely notice some changes. So physical status post-vaginal delivery, our uterus pretty much is back to pre-pregnancy size. Bleeding stops, or it can even temporarily like restart again. But for most people, It's pretty clear. And you would be cleared by the 6-week for sexual activity and exercise. So we do end up going for our 6-week postpartum appointment. Just to make sure that everything, check how everything's doing, how you're feeling. Everybody's going to be a little bit different by this point. So say, for example, even if you are in the clear for sexual activity or exercise, I think that especially if you're a person that's a little bit more attuned to your body, you can tell kind of where you're at. And for sexual activity doesn't mean like you have to rush into it. But if you feel and you're in the clear, test it out, see where you're at. And if it doesn't work for you, then, like just wait a little bit. It's all really up to you. Physical status, post C-section delivery. Uterus is back to pre-pregnancy size as well. Same with the clear for sexual activity and exercise. Your scar may feel numb or itchy. That comes with healing. You may be cleared to drive and be able to do different things like lift baby, but just remember that all of this varies and it just needs to be cleared by the time that you are going for your 6-week appointment. Mental health and hormone status, we're still feeling exhausted and overwhelmed. It's still there. It's still a part of it. It's to be expected. But if you are experiencing deeper feelings of hopelessness or anxiety by this point, and it's pretty present, just make sure that you mention it to your physician. When, we talk about the baby blues and the early first weeks are pretty normal. That's kind of all a part of it. But when we're starting to see, that we're getting into, 3 months that we're still strongly feeling like that, then we just want to make sure that we are getting the help that we need if we are starting to get more into the postpartum depression area. So I just had to add this, and I wasn't using as much pictures for this one, but just kind of like the struggle is real, the real part of where you're at, whether you're in your comfy clothes, your PJs. I remember living in my robe a lot, definitely for the first month, and dealing with feedings and different things like that. So just make sure you get your rest. 6 months. Physical status post-vaginal delivery. Hair should stop falling out. So yes, this is a thing that could happen, in between the 3 to 6 month mark, I believe. But it should stop by this time. Prolactin levels are typically decreasing, which should help with the hair kind of stopping doing that. Full bladder control should return. Milk supply could change. So the way that we could see it change is that we may notice less of a supply. And this may influence different things like our period actually being able to come back at this time. Once again, everybody's different. Breastfeeding usually contributes with kind of keeping the period away. However, all of our bodies are different. I got mine really, really, really quick. So the moment that I decided to give myself a break and supplement throughout the night, I think it was within the first 4 to 5 hour mark that my breasts weren't stimulated from pumping or trying to do breastfeeding. I instantly got mine back. That it was almost hard to determine whether it was still bleeding by the 6 months or by the 6 weeks. I got it as soon as that. So it doesn't always determine, it depends on our body. So there's always that chance too of being able to become pregnant again shortly after. So just make sure that you protect yourself for that if that's something that you are wanting to choose for yourself. So physical status post C-section delivery, potential can be more tired at this point. Oh dear, like we need to hear that anymore. We know that being a new parent is tiring, and through the different stages of being a brand new parent, different sleeping schedules, different things like that, of course, like we need to hear anymore that we're going to be still tired at this point, but that's what happens. Milk supply could be different. So just depending on how you're feeding, once again, some people may be choosing to supplement with breastfeeding, different things like that. But even with C-section, that's all the same of maybe seeing that change in the milk supply and your period coming back. Mental health and hormonal status. Mental state should be more positive by this point. You should definitely feel that you're like a little bit more yourself, or that you're starting to know a little bit more, just feeling more stable, right? More level. Prolactin levels are typically decreasing by this time, like I said earlier, which that's what influences a decrease in the milk production as well. It's still there though. As long as baby is stimulating the breast, generally it should still be good. So going into the 1 year, you did it. You made your first year. Physical status post vaginal delivery, you may be feeling right back to your old self, and your body still may, feel slightly different. Our bodies are always slightly different after having baby. We will notice just different, you know, different size in our hips, or some people notice like difference in your feet and different things like that. So we may feel like ourself, but we still notice a little bit of those differences throughout our body. A physical status post C-section delivery, your scar will be faded by this time, but it still may feel a little numb. And note, if you are still experiencing such things as painful sex, or having urinary incontinence, so you're noticing a difference still in your bladder by this point, postpartum, please speak to your doctor. These things are normal. However, that is just our body telling us that these things need to be addressed, and there's ways to go about that, and that's okay. Mental health and hormone status. So you should be leveling out and feeling more like yourself mentally as well. Mental health highly relies on how we're adapting to motherhood or parenthood. Or factors like quality of sleep, of course. It's important to prioritize your health to the best of your ability with self-care, nutrition, and exercise. So I think that kind of goes without saying throughout just life in general, especially your first year. But of course, these things are going to just help adjust a little bit more to best serve our healing throughout the first year. So I hope you guys found this interesting. Like I said, I think it's beneficial to kind of go through, even when you're pregnant, to kind of have a feeling of what your body may feel like afterwards. And you guys have a good day.